Hello, welcome to the Collaborative Practice Podcast, hosted on the Guardian Podcast Network. We are excited today to be bringing in a new guest. But before we do, let's remind you what the Collaborative Practice Podcast is. So I myself am Chris Seitz. I'm an emergency physician by trade and also the CEO and Chief Medical Officer for Guardian Medical Direction. And I'm here with Jason, who's my brother, but also a firefighter, paramedic, and RN, as well as our Director of Education at Guardian. And this podcast is all about coming together in healthcare, business and innovation, right? Healthcare business and innovation, and how we can all come together to do something new, different, better, more exciting in healthcare as a whole.
And what a fitting guest we have today for that.
We do.
Because we will be talking to Devin Marble, who is marketing director, I believe, over at VRpatients. What VRpatients is, it's a pretty cool concept. So there's they're sort of specializing right now in pre-hospital training, but they are essentially striving to teach paramedics, EMTs, EMRs, practical assessment skills completely in virtual reality. So taking the whole, you got to be sitting in the classroom component out of it. We had an opportunity to meet Devin and his team at EMS World 2022 down in Orlando, Florida this year. And we hit it off pretty quick, and we got to you and I got to sample some of the product a little bit and jump into some VR scenarios and goof off in those. And what a cool thing, though. So, what's interesting about VRpatients is most of, there's a few out there of these companies that are doing education in virtual reality space, but
specifically healthcare, specifically healthcare, pre-hospital, even nursing education, but strictly VR. Yeah, there's a few.
But what's different about VR, and I think we cover this in our interview, but what's different about VRpatients is that they're not doing individual cases and then selling those cases to the end user. They're selling their platform. So not just a scenario, but the ability to build endless scenarios in their platform so that really any level provider, EMS is the tip of the iceberg with this thing, man. There's so much that you can do. So we talk a little bit about how VRpatient works, sort of the trends in education with that, and how that's going to kind of affect and interrupt the space in a good way.
There's huge opportunity. There's huge opportunity in healthcare education and virtual reality to come together to do some pretty awesome things from an education standpoint. And not only from an education standpoint, even to a community social standpoint, where and I think we talk about this in the interview, but where could you imagine, how I can share my pictures on Facebook? What if as a doctor I could share my patients, and you could think about when you're at a dinner party and people are what's the worst thing you've ever seen, right? Whether you're a nurse or a paramedic, what's the worst thing you've ever seen? What if you could be let me show you, and you just bring them into it's really cool. Where this can go is huge. So and Devin gets into kind of the cutting edge, innovative stuff they're doing over at VRpatients. We geek out about it a lot, which is fun. So that's what this interview is. So we'll jump into it. If you are interested in hearing more about what Guardian's up to, make sure you check out, you can see not only you can listen to this on Spotify and that sort of thing, but you also can watch this in the interview actually on Spotify, but also on our YouTube channel. And give us a like, give us a follow, drop some comments. We want to connect with you guys. So let's check it out.
All right. Well, welcome, Devin. Thanks for coming on the show. We're excited to have you. How are you doing today?
Thanks, man. Doing really good, man. Thank you.
All right. So we already described this a little bit, but Devin works in marketing for VRpatients. Can you just give me a little intro of yourself and a little bit of your background, and then tell us just kind of generally what VRpatients does so we can kind of set the tone here?
Yes, sure. So my background, I used to work in film and television, and then I just left that all behind and became an EMT, then a paramedic, and then a genetic researcher, and then I was pre-med. I wanted to be like Chris when I grew up, and then I canceled my med school application January 2020 and leaned into digital because all of this marketing, graphic, digital stuff was something that I was practiced at in the industry, and so it came to me, and then it came easier to me, and then when VRpatients came along, it was like a unicorn, right? I was this medical professional who knew how to do content development, and they needed someone to help disseminate how their product is easy to use, and it's so powerful. I was eager to jump in, and that's how me and VRpatients became acquainted. And that's a little bit about me. Do you want to know about VRpatients itself?
Yeah, tell us about
Yeah, let's jump in.
VRpatients.
So one of the things that we've been talking about, just to kind of set the stage for our listeners, is really, again, this podcast is all about, where we can collaborate in healthcare, and the education side obviously is very disjointed a lot of times. I mean, I think in a lot of fields, right? The healthcare sides, especially, like you've got, your actual even in like nursing versus medical school, like even philosophy is so different. I mean, so like there's a lot of disconnect in the healthcare education space.
Yep.
And there's probably some new challenges that we're facing in that space as healthcare is just starting to face more challenges post-COVID and things like that. So let's talk about... So what we like to talk about in this podcast, too, is new innovations, like where we can solve for these things.
Sure.
And obviously that's why we wanted to have you on, because VRpatients brings a whole new option, I feel like, right, to education, specifically healthcare education. So, yeah, why don't you give us a framework of what is VRpatients? What do you guys do?
Sure. And I just want to touch on, I'm actually still adjunct faculty at our community college here locally.
Awesome.
And I worked as a hospital medic because I learned more working with the doctors and the nurses. So I feel you right there, right? Trying to translate what we're learning in class and speaking to the students and putting that into practice. So I think the big innovation that VRpatients brings to the table is the ability to kind of be more effective as an individual educator. Not just because you're using a platform that's like immersive and you're in it and there's like a person in front of you. It's because one faculty member can immerse 100 students simultaneously in that education.
Sure.
So what VRpatients is at its core, it's a virtual reality patient care platform. It's not how do I do CPR, how do I do IVs. You got to do all that in person with your proctor. When we did IVs, we were like poking each other in class. It was a very bloody day.
Yeah.
But you got to learn. You can't learn that with an Oculus trigger pull, right? You have to learn that hands-on.
My first
But the
IV start was with Chris
competency-
in the hospital. I did my clinicals at the hospital that Chris was in residency at. So I got to pair up with him, which is like totally like cheating, like when you can just like hang out with an ER
Paired up
doctor
with your
instead of one of the
brother
nurses.
doctor,
Yeah.
you
So,
cheater.
but I got to do like all kinds of stuff. I was in areas that it was like completely illegal to be in. I like started like
He's
I
intubating
assisted
people.
I assisted in a central line. I got a bunch of blood from a superbug virus guy, like all in my eyes because Chris didn't give me goggles. It was like a whole mess. But that being said, I started my first IV on Chris, and he was kind enough to let me start it. And I must have come down to like a 45-degree angle or something, and just he was swollen for like 2 weeks.
My
afterwards.
whole forearm.
Oh my gosh.
My whole forearm was just this massive bruise, like swelling.
So their doctor's like meth addict doctor. Hi, how are you feeling?
Yeah,
today? What can I do for you?
exactly. But sorry, I cut you off.
Glad to know that you have a superbug in your eyeballs and we're remote. This makes me feel much more comfortable.
Yeah, there you go.
You can't catch disease through a podcast, can you, Chris?
No, not yet. But the technology is
All
coming.
right, just check it. We're almost there. Virtual reality is getting really good.
Exactly.
Okay, so I'll give you a quick visual. So you put on the goggles and like there's a patient in front of you, and it's either in a clinic in the bed ready to go, or they're out in the field on the cot, and they're huffing and puffing. You don't know what's wrong with them, and the system doesn't tell you. You have to figure it out. And so it's all about competency and assessment. So the student has to walk up or teleport up to the patient. They have to ask them questions, take off their clothes, look for trauma, and then get that dialogue going, then start to initiate a differential diagnosis, a treatment plan, transport. That could be transporting from the emergency department room into the hospital admit. It could be from the field into the emergency department. It can go from clinic to emergency department. And I think I'm kind of getting a little bit ahead of myself, but essentially that's how the platform works. You go in, you decide what you're going to do to treat the patient, you make your treatment decisions, and then there's a timer up top, and it's got objective grading rubric built into it that links to an LMS, which means you can't fast forward. Right? You have to sit this one out. You have to go through it. If you have too many critical fails, it'll probably end early. And if you win early, it'll probably win early. And then you get a quick debrief screen, tells you your grade, your score. Your instructor will have set how many times you can do that scenario. So maybe this one is like non-destructive. Go to town. Do it 10 times. Just keep killing the patient until you get it right. Because at the end of the month, you only get 2 tries, and you need an 80%. Okay, so student goes through it. They get their debrief. And it's digital. It's asynchronous. They can do it in class, at home. They can do it on the web. That's our WebGL version of the platform. So you don't actually need a headset. You can just log into Chrome.
Yeah.
And it's not quite as immersive, but it's still really cool. And I can actually show you in a little bit whenever you guys want. I can show you what that looks like just with your mouse becoming a stethoscope or the pen light versus being in VR and you got to like get up in the patient's eyeballs and put the pen in their eyeballs, which you do have to do. And they actually constrict. When you give a med, they actually respond. You see the numbers change on the monitor. And it's not instant like a game where if I were to say give a medication, glucose, let's say it's a hypoglycemia case. Right? It's like, okay, this is obvious. I got to give this guy some sugar. So you give him some sugar, and then you look at the monitor, and then the sugar didn't change. You're like, what the heck? What did I do wrong? It's like, well, that's not the way it works in real life. You got to give him a minute.
Right.
What did Louis C.K. say when he was talking about like cell phones and texting, and people get so frustrated. They send a text, and it hasn't arrived yet, and he's like, it's going to space. Can you give it a second?
Give it a second. Right, exactly.
Just give it a minute. Well, that's the way physiology works, right? Give it a minute.
Right.
So we try to be realistic with it.
That's really cool. Chris and I actually just did a couple of your trial scenarios recently, and we had some fun doing that. That'll be online soon, so someone can check that out.
How many times did you kill the patient?
It's essentially, it's not, we didn't do it terrible, but what's hilarious is that like it's so much more just watching Chris experience VR. Every time Chris gets on VR, we both have VR headsets. We play games on VR. Every time Chris is in VR, he's so amazed by VR that it just distracts from anything we're trying to do, whether we're trying to shoot the bad guys in a game or we're trying to like treat a patient. But all of a sudden he looked up at the timer. Those ones are capped at 10 minutes. So all of a sudden he looks at the timer and he's like, I only have 2 minutes left. I haven't done anything. I've just been like walking around their house, like checking it out.
Looking for clues. Right. What's this bottle doing down here, sir?
Exactly.
And this is one of the cool things about VRpatients compared to other healthcare education VR, because there are a couple out there, right? Like VR companies who are trying to tackle this problem of healthcare education. Most of them, if not all of them at this point, and VRpatients is the only one that I know that's not this, is that if you want to do cases on their platform, you do their cases, right? They have, or you pay them a nice large amount of money to go build the case you want them to build.
Right.
VRpatients isn't that, right? VRpatients, I can actually go in as an educator and I can build out the scenarios myself. And I can decide what the critical action steps are. I can decide how the student passes or fails. That's, I think, really what sets VRpatients apart in this kind of new innovative space of VR technology and trying to mesh that with educating in healthcare, because now I'm not limited to, again, what I've paid for necessarily. You know what I mean? Like I have the ability to go in and figure out what I need to learn or what my students need to learn and build that myself.
Well, it's very innovative too, because we're not giving somebody a question repackaged. Like, you're not giving an educator education to pass on. You're giving an educator technology that allows them to educate, right? So it's like limitless, right? We're not just taking one narrative question and making it more immersive. We're giving them the ability to take thousands and thousands and infinite amount of cases and build them out as they please and really go anywhere with it, which is cool.
That's correct. If Harvard or any number of universities that have a massive endowment would like to utilize VRpatients for their students, great. But they can afford $250,000 a year on a simulation package for, let's say, some of these platforms will charge $5,000 per headset per student per year. So if you got 50 students, you're already at $250,000. That's not even for any kind of custom case. For example, Chris, you get home from the emergency department and you go, dude, I had this stroke case, and it was crazy because the patient was 25 and she had a stroke, but she's got a blood condition. And when she came in, she had a laceration on her arm and she's got some clotting issues. We started by treating her arm and realized, oh my God, she's got a stroke, right? You order that case from some of these providers, that's $30,000 per patient because they need to pay a gaming engineer to build it. So rightfully so, right? That's what and I'm not knocking on those platforms. That they're making a lot of money off you guys and they're doing a good job. But to be quite frank, our goal is to provide a virtual reality platform that everybody can use. Anybody can use. We're talking a workforce of nurses, paramedics, emergency residents, medical students, and actual just real professionals looking for CEs and continuing education. This is everybody. This is the front line, and we are at a deficit. We're underfunded, we're underserved, overworked, right? And we need more people out there. So that means we have fewer faculty trying to teach more students. And now, post-COVID, you've got hospitals charging nursing institutions just to get in there so they can do their clinicals. So clinical time's getting harder, right? And it's like, how do we make someone more effective as a faculty member and provide the students a very immersive and and something that actually makes them better on day one when they get the job, and it's their first day as a nurse, paramedic, or resident physician, and they're on day one. And it's like, wow, you're almost as competent as a 1-year nurse. It's like, yes, that's what we want to go for, because you've seen 100 patients and they were all custom. So what VRpatients did was we built our platform from the ground up, where we have circumvented the need for a gaming engineer to then change your case for you. So we provide you with 20 patients end to end. You can just play them as is. You could just go to town. There's a stroke case and heart attacks and you name it. But if you want to change the demographic, you want to give them some moulage on their skin, you want to change their starting vitals, their position, the location. Maybe you want to change what medications are available to the students. You got like 135 to choose from. Maybe you want to change what physiologically happens to the patient if the student gives the wrong dose. Or what if the student just stands there, doesn't give any dose? Does the game wait for them to click, or does the patient pass out? That is the kind of power that we want to provide to everybody. And you don't need to be a coder. So it's drag and drop. I'm not saying it's not complicated. This isn't a toy. It's a professional system. We pride ourselves in being able to train people to use it. So we give a man a fishing pole and we teach you to fish, or a woman. And so the whole idea is, if we can empower people to do that, then eventually you don't need VRpatients anymore. You can go to town. And when you have that rough call or that unique patient, that high acuity, low occurrence, you can just build it. And then your students learn from it the next week or the next day. And that's super powerful.
We talk a lot about, like, in our education platforms and stuff like that, we talk a lot about, like, the importance of experiential learning, right? Like, nothing really replaces experiential learning. Like, I can read a question or get a question wrong and that question can stick with me, or I can have someone tell me a story and that can stick, but nothing sticks with you like having had a patient in this scenario and had things go wrong or right. In either case. We always talk about in education, like, in the classroom is where you want to make mistakes and get messy. And I feel like this platform allows people to do that, right? That's what's so exciting about it, is I can gain experience in these cases. Now, it's not going to be real life experience where I actually saw a real person, but I can get the questions wrong. I can make the mistakes in these scenarios and have real consequences play out in front of me. And then if I ever bump into these, especially those, low acuity, high risk type situations, oh my gosh, I've had a case like this before. Now, it wasn't a real person, right. But I've had a case like this before, right? And so that's a really value add for an educator, I think.
And what you just spoke on there is a key piece, right? Like, it wasn't a real patient, but I still had the experience. This kind of takes us to, and I think, Devin, you kind of hit on some of them already, about the biggest challenges facing healthcare education today, right? I mean, and some of them you are kind of, so the lack of clinical spots, right?
Yeah.
There is a limited number of places and areas that you can go to get that experiential learning, like Jason's talking about, where you can actually talk to and work with real patients, right? We actually even saw this, I mean, especially when we talk about like the EMS side of things, like with intubation skills. I don't know if you guys remember, but like there was like a whole period of time where like there was a lot of lobbying to say, hey, you know what, maybe paramedics and paramedics shouldn't be able to intubate,
right,
because they don't have the ability to. But I remember being a resident and like needing to learn how to intubate because I'm going to be an ER doctor someday, and you're almost competing with the paramedics and the CRNAs and the other people to get, because we don't even intubate people as much anymore. Now we do LMAs,
right,
we do other things. So that's one of the big issues that we face is the lack of clinical spots to be able to test that. And then partner that with another thing that you mentioned, which is just shortages in healthcare already. If we're having that problem and there's shortages, and we fix the shortage problem and get more people into the education, well, even more so now, what do we do? And that's where the big opportunity comes in with virtual reality, is what you spoke on earlier. Now, one instructor can build out a case and even sit and learn with 100, 200, 300, because we're not limited now to the physical, the physical OR of where we're practicing these kind of skills.
Well, I'd like to kind of follow up on that and ask you a question, Devin. So that being said, there's a lot of challenges. There's obviously a lot of nuances to now making that type of education, or like solving that problem in the right way, right? So like, what do you think are the biggest challenges when it comes to like taking VR technology and adapting it for healthcare use, right? in education, we can just say even in just education, because there's a lot of aspects outside of education where we could use that, right?
And there's lots of challenges.
Where have the biggest challenges been for you guys? Like in terms of like, is it more technological? Is it more like making it more realistic? Is it more accrediting and like trying to get decent cases built out? Like where do you see the challenge being of like, if we're going to solve this problem with VR, what's the best way to do it? And what are we up against?
So I'll try to hit those in a little bit of a list. Let's talk accrediting really quick. So what's unique about us is that our platform is a tool that is accreditable. So that's like saying a Laerdal mannequin is accredited. It's like, no, it's not.
Sure.
It's the person who creates the simulation with the tool. Then that becomes accredited.
Right.
That's what we offer in a virtual reality way. So Chris, Guardian, if you guys create something and you've got your accreditation, thumbs up. Like CAPC believes in you guys and the education that you offer. So the tool is accreditable. And a quick note, I just got back from the Idaho Trauma Conference, and one faculty member, is adjunct faculty, he's a paramedic. He's not a coder, not an engineer, and he put 40 people through virtual reality simulations in one day. There were 4 trauma sims per student in a big room, and we had them like boxed off in like 6-foot squares that were 8 students at a time. So there were like 5 sessions in the day, and one guy built all 4 trauma scenarios and put all 40 people through it in one day.
Wow.
And that is just something that has never been able to be done before. And the crazy thing about it is that it's kind of infinitely scalable. If the room was big enough, he could have done 100 people. Because they're all doing the same sims. I mean, you don't know exactly which one they're doing. It's one of 4. But he has set those rules. Those run asynchronously. They all just operate through a Wi-Fi signal. You need about 1 megabit per second per headset to make sure that everything's running smoothly. Other than that, the system's downloaded onto the headset's memory. It's just sending data back and forth between the cloud. And so they're all able to do their stuff. And that is super powerful.
Yeah.
Because he can do that stuff in advance to a conference arrive, and that's his sim day, and he just pops it up, and it's very quick. So definitely accreditable. They all got CMEs. It's definitely scalable for one individual. Now, some challenges. The development is a challenge.
Yeah.
It's I'm in dev meetings every 2 weeks, and we talk about like, okay, what's our next sprint? That's what we call it in software, right? You're going to sprint to this next goal, and we're going to see what we've hit. And what's coming down the pipe is so incredibly exciting, and I don't even think I have permission to say some of it here yet. But like, I'll just like give a couple of hints, like things that are coming down the pipeline, like being able to do pediatrics, huge.
Yeah.
Okay. Things like, and a lot of people don't think about this, but like you're in virtual reality, and you see that this person has they need a tourniquet on their leg. They've got a bleed. They've got something going on their leg, a laceration or whatever. But in VR, like the VR dude, he's got pants on. And so you're like, how do I know that they have a bleed on their leg? Well, did you disrobe them, and did you assess them and look at their blood pressure? And then when you take their pants off, now you see redness on their leg. And what we're working on now is like, you'll be in the sim, you'll be interviewing the patient. If you look down, like the blood starts to seep through the pants.
Very cool.
That's awesome. Yeah.
And you may throw a tourniquet on, and you go back to treating, and the blood pressure's still going down. You're like, oh, shit. Oh, my God, it's still bleeding. You throw a second tourniquet on. And those types of nuanced things to be able to develop in virtual reality are a big hurdle, and it's what we really focus on.
Yeah.
Because from our perspective, if we can provide the best product possible, we will worry later about spending millions of dollars on marketing, which we definitely do not do. Right? I'm the one-man army. We're a team of 3. And,
You're like,
and
you
we
wish
do the
you were
best that we
making
can
millions
to
of dollars
educate.
doing their marketing. Yeah, individually.
Oh,
right
man. I'm swimming in it.
Right.
I'm very, very happy where I am. But I will say that we spend our time and our effort on the quality of the product for you to be able to do something amazing with it. And we hope that our customers like try to break the platform and do things with it that we never thought were possible.
That's funny. That's wise, because I would imagine, like, from even our experience in it, like quickly, it's very easy in a VR platform, especially with where like video games are now. You know what I mean? It's very easy to be like, to very much notice what something can't do. You know what I mean? So solving those little nuances, like, put a second tourniquet on, it seeps through. Like you jump into these platforms a lot of times, and your first thought is like, well, what happens if I do this? Like you said, you want to break it, you explore a little bit in it, you know what I mean, to see how close to reality it truly is. And when you've solved that, you know, preemptively, I'm sure it's a challenge to like think of what those things are going to be. There's probably a lot of testing involved where you have people jumping in and being like, well, can it do this? And you're
yes.
You can now. We'll put it on the sprint.
Most of them, all of them, we have SMEs. We call them SMEs, subject matter experts, right? And I want to say that this platform is built by EMS for EMS and nursing, and built by nursing. So most of the people that work for this company are nurses and paramedics.
That's awesome.
And we have a medical director. So all of these people are not just like, they don't just vet the case, like they build them. So you have a nurse building this, you have a flight medic building this and testing and trying to break it and be like, all right, this didn't work. Or talking to the dev team and being like, dude, you cannot drill a pediatric patient with a yellow intraosseous. It's too big. Those are like 1.5 inches long. They need a little pink one. And you got to change the color of that. That's just the way it goes. You know, and that's a small little dev thing that's like that. People will notice those kind of realism things, so we put them in. Now, one more challenge I'll respond and I'll answer to you is, this is kind of a silly one, but it's just the way it is. There are a considerable amount of people, surprisingly, who actually think that like virtual reality, the robots, you know, are going to take over and they're not going to have a job anymore. Yeah. And all I got to say is we're definitely not there yet. Maybe one day that'll happen, but I just don't think it ever will, because the contextual connection of what you're reading and then competency, how you're going to implement that and what you're going to do with the information you got in your book, right? Well, that would be the VRpatients virtual. And then that person with the history, with the wisdom, with the they've done the experience, bringing it all together for you and telling you how to be a better version of yourself in that job, in that role, is critical and not going to ever go away. So if I could just tell people, like, don't worry about virtual reality like taking over the world, it's just not going to happen. But I will say that it is possible. So I've had some instructors or faculty say, what if I get replaced? I could see in real life what could happen is you could potentially find yourself in a position where if you choose not to adopt something, when there is a large wave coming, that you could be replaced by a person who will adopt that, because we need to produce bigger, faster, stronger students with fewer resources. And so it's almost like I use the analogy of like you gotta put down the chalk and pick up the marker, because whiteboards are coming to the school. And I know you've been using a chalkboard your whole life and you love it, but if you just start drawing in blue and red, students will understand venous blood flow and oxygenated blood flow better. So please pick up the marker and start drawing in color. And now our markers are 3-dimensional and they're virtual, and like you can put it on your face and suddenly you can teach something and a student will never forget it because it was right in front of them and there was a person sweating and panting and they heard their lungs and they were like, holy my heart's racing right now. You don't forget those.
I think that's too, again, like where we really can come together in healthcare is like technology and innovative companies like VRpatients, which is what you guys are doing, partnering with educators and then the students. And I think sometimes we have to remember that, like, as nurses, as doctors, as healthcare professionals, we're lifelong learners, right? The science changes. We learn tons more. We see new patients every day that don't look like the patient we saw yesterday. So we're always learning. So if we start seeing ourselves as the students, right? I don't care if you're a 65-year-old physician or the senior nurse. You see yourself as the student, and we start to say, hey, where can I partner with the educators to share with them the knowledge that we want as students? And then the educators can partner with technology companies like VRpatients to start to build. That's where we can really start to see some like exponential increases in the quality of the education we're putting out there, the amount of it, the content. I mean, I'm thinking to myself too, even like how cool to be living in a world where like I see a patient and probably someone else has seen this patient before, right? But I don't know, because I work at a community hospital and I'm in my region, and the guy who saw this patient even yesterday saw it over in Indiana, and I don't know anything about it, so I'm reading the books and everything. But what if I saw the patient and there was a platform where I actually, or maybe the guy in Indiana saw the patient and he then went out and built the case, so now everyone has seen that patient. That's where the really it's so powerful, right? I mean, like now we all
Yes.
get to share
You're
with
talking
each
about
other.
something?
Yeah.
It's super true to our heart. So we've got we're approaching 2,000 cases in our system. All of our customers combined, building stuff, right? And that is growing extremely quickly. And when we get to, maybe this is just an arbitrary number, but it's what we've chosen. When we get to about 10,000 cases, we're going to prop up a marketplace, right? That's the goal for this type of community sharing.
Yeah.
And who knows? Maybe that entrepreneur, that community college person can be a source of revenue, and they can bring in and they can develop their own scholarship based on the scenarios that the community college builds and provides to the world. You're talking about some other things that I think are super important. Some areas just demographically don't get a certain type of patients, but you do sometimes. Right. They come in. So you got to train on those. But then you have to spend resources training on something that you just don't see that frequently. But they're very resource intensive and expensive. We spend a lot of money on these types of patients because we're throw everything and the kitchen sink at them, and they may be in a no-win situation, and it's you got to do it. And let's train on those.
It's interesting
you can build that stuff.
You were talking about pediatrics earlier. I remember going through PEP instructor training and PALS instructor training. A lot of those videos, people are I saw this in the last AHA update. They had the same patient up on there. And it's that's because there's only been 4 times where they could get a pediatric patient with this condition where they could film it. It's why you see nurses moving in the background. We don't even have enough cases to so this is so much easier to be able to take a case that happens, expand it, have everybody look at it, and build research off of that. There's so many opportunities to be able to use this technology to kind of unlock that. I guess my next question for you would be, obviously, I think when it comes to collaborative practice, I think collaboration between technology companies and advancing technology and the medical field. In this case, I think it gets married. It happens in education. That's where it starts, right?
Yes.
So how do we? And maybe we don't know the answer to this, but how do we advocate for that? How do we advocate for that collaboration? How do we help technology advance like that as a provider? Maybe I'm not in education. Right. Maybe I'm not. How do I advocate as a provider to make sure that we're keeping up with the times, I guess? Because I think COVID, especially in education, COVID was a shock for a lot of us in the sense that oh man, a lot of our systems are very outdated. This technology has been around for a while, and we should have been implementing it, maybe 2 decades ago in some cases, right? So how do we prevent that from happening again? How do we advocate for this,
So I think, I don't know if there's one answer for this. I think one way to do that is to lead by example and then include the people who have loud voices in education in a way that is authoritative, but also is value added for them. And so I'll give you an example. Again, I was at this Idaho Trauma Conference, and one of the keynote speakers, his name's Lane Lamoureux, and if you get a chance, look him up. He's amazing. He is telling the story about a guy who fell from 100 feet out in the mountain in the snow, and he landed vertically, heel, boom, on the ground, and his femur went up through his pelvis. Ugh. And he was just obliterated, right, physically, and he ends up in the ICU, and he's telling the story about these ICU docs and nurses calling his emergency contact, who's his mother, who ended up jumping on a plane to go be by his side. And you're understanding as he's telling the story, he's talking about himself. So he survived because he's standing right there.
Oh, wow.
And he's telling the story of a person who's not going to survive. And they almost said he's not going to. He hasn't responded until his mom arrived at the bedside in the ICU, and she puts her hand in his, and he squeezed her hand. And they were like, "Oh my God, there is something there. Okay, we're going to throw resources at this guy." And they bring him back to life. And he has an amputated leg, right? And he's telling the story about overcoming adversity and hope. And he's crying. The freaking audience is crying. Everyone's going insane. And I walked up to him after, because I had a freaking table over there, right? And I walked up to him after, first of all, just thank him for his time. And then I said, "Can I ask you a question?
Can you build this case out in VRpatients?"
Well, we could do it for you, but yes,
Right.
thank you. You hit it on the head.
Yeah.
I was like, what if at the end, and this is a twofold question, right? So, Lane, what if at the end of your talk or sometime in the middle of your talk, you told the whole audience everyone's going to try to treat you now, and they're all going to learn from your
How cool, yeah.
case. And then I said, what? I'm getting chills right now because this is the part that I want to write about, I want to talk about more, which is mental health of our frontline worker, whether you're a nurse, paramedic, resident, physician, doesn't matter. We're all getting drained, right? So what if you could try again on a patient that you lost on and win? And then what if you win on that patient and then train your department or your nurses on that patient? And now suddenly the person who was mentally affected by that really hard case that you thought you were going to win that one, and that you lost the patient. And so now you now are going to read it, write it, teach it in virtual reality to everyone. And what did that cost you, right? That shouldn't cost you $30,000 to build that patient to help with the mental health of your department or your people. That should be something that is a tool that you can do. And so I asked Lane, what would you think if you got to try? Because he's not a medical professional. I think he might be an EMT now, right? But he's a second grade teacher. And I was like, what would it be like if you could go into VR and like see a representation of your 20-year-old male with all these trauma problems, and you got to try it, treat it, and then you got to educate other people on your case, and they got to try it and treat it. And he was just like, wow. He had never even considered something like that because it has never been possible before.
So one thought I just had is that, I mean, we live in a world now, like with social media and things like that, where I can share with everyone like my top 5 books that I love to read. I can share everybody my like the 10 recipes that are like, you know, that kind of thing. I can share like, what if every healthcare professional could share their top 10 cases, right? Like, what if every healthcare professional was like, there's always you get asked all the time, like, oh, what case really stood out? Oh, this one. You want to see it? You want to do it? You want to experience it? I mean, like, this is where we can just take healthcare education so much farther. I mean, I remember, to Jason's point, when PALS updated their videos and it was real kids. Even just that, all of a sudden you could teach to that so much better than you could just reading a scenario out, let alone being able to now actually go in and actually experience the whole case. Another thing, too, where I think that we have a lot of opportunity and where I think VR technology and a platform like VRpatients brings a ton of value is continuity of care and the ongoing care. Right? So one of the biggest, not complaints, but one of the biggest challenges we have as healthcare is developing up, and, we're like, I'm an ER physician, I'm not a cardiologist, right? I'm a cardiologist, I'm not a cardiovascular surgeon, though. Sure. But, so like, or I'm a paramedic and I drop them off the ER and I don't know what happens to them next. What if this is an opportunity for us to know? What if this is an opportunity for me as an ER doctor to be like, hey, like, I treat the STEMI, and then they go to cath lab, and there's sometimes complications in the cath lab. What if I could go just experience those and see those? Because now I'm better prepared for what I'm preparing that patient for. What if I'm a paramedic who can see what happens in the ER to patients after my initial care? I mean, this is where I think there's just, again, there's so much where we can really all come together and change education, especially in healthcare, forever in such a value-add way.
That lofty idea you just floated is like release 15, and we're on release 8 coming up soon. But it's still a cool idea.
Exactly.
Well, that's great. I loved your answers. You said loud people in education, which I think is important too, and just, being the change that you want to see, right? Like being a personal advocate for it, setting an example. And I think a lot of times we don't realize as providers, like we think if we're not in education, if I'm not an adjunct faculty at my local community college, why should I care about the next generation of providers? It's like, well, because of the people that'll be taking care of you.
Because they're going to come to your door when you call 911.
Exactly, right? So I do think that, like, we all have a little bit of a duty to this next generation of the people coming up. We have a duty to turn around and help somebody else, the next person in nursing school out as soon as we're out of it, right? And I think individuals recognizing that's some pretty powerful change right then and there, right? So, and that's huge.
And huge. And Chris, I think you hit on a solid idea. Like, let's do a collective. Let's find like a dozen physicians or nurses or whatever from across the country, and everyone build one case, and we'll support that. And then suddenly, just imagine with like someone's name attached to it who is a big person, and it's like, oh my God, that's that pediatric physician who like conjoined, who disconnected those twins in Brazil or something like that. It's like, holy crap, I want to do that guy's case, right? Of course you do, or the Harvard case, or the whatever case, right? Because we should be able to. I don't know. There's just a certain amount of notoriety behind building something, and people go, wow, I learned a lot from that. And then they share it, and then they want to build something on top of that, and then they share it. and then we all become better, and a high tide just raises all boats.
Right.
Exactly. Awesome. Well, Devin, thank you so much. I mean, we so appreciate you coming on. Again, we've had the privilege to be able to play in VRpatients a little bit. We'll continue to do so. For our listeners who are now super intrigued and interested, and they're like, oh my gosh, I'm an educator. I want to go build cases. I want to go check this out. How do they find you? Where do they find you guys? And we'll put it in the notes too. But
yeah, sure. I don't know if people normally do this. I'm just gonna put my email on the podcast. But first of all, you just go to VRpatients.com and you will learn all about the platform, and you can inquire and check it out and stuff like that. Just straight up email me if you have an idea. dmarble@VRpatients.com. Marble is in like the rock. I'm a Rolling Stone. Don't take me for granted.
There you go. Perfect. And we'll throw it in the notes too. But hey, again, thank you so much for joining us. I mean, super exciting. Again, I mean, like, we're all about where we can come together in healthcare, and I think we hit the nail on the head with this one. This is such an opportunity for everyone to get involved and really change healthcare forever if they're willing to do so. So, Devin, thank you so much for your time. We appreciate it. Thank you, guys. Take care.
Take care.
Hey guys, thank you so much for joining us for the Collaborative Practice Podcast. If you want to see what we're doing over at Guardian Medical Direction to contribute to the collaborative practice model, check us out at guardianmedicaldirection.com. What we can't do, though, is build a community without your involvement. So we'd love to hear from you. Please reach out to us with anything. If there's topics you want us to consider covering, if there's people you think we should interview, or if you just want to drop by and say hi, shoot us an email at info@guardianmedicaldirection.com. Again, we can't thank you enough for joining us as we build a true community around collaborative practice in healthcare. Thank you so much, and we'll see you next time.